Hello, hello, hello. We are live. I am streaming here on LinkedIn and up to my YouTube channel, and I have Instagram right here. So, unfortunately, I cannot yet stream Instagram in this platform yet because I have not been granted the permission yet from Instagram to stream from desktop for lives. So, when you are here, say hello. Would love to see you in the chat. And if you are watching the replay, let me know you're watching the replay. I would also love to hear from you. So a quick intro about me, just so you know who you are talking with right now. So I'm Carrie Cohen, for those of you who don't know me, and I've been a practicing psychotherapist for 25 years. I have worked with all kinds of dynamics and issues. My focus right now is really helping couples strengthen their marriage, prevent divorce if that's what you want, and fall back in love again. But I have a very strong mental health background as a psychotherapist, and I started my work in trauma. So I thought it would be an appropriate time to talk a little bit about prioritizing your mental health during times of crisis. There's all kinds of crises. And currently there's a global one happening, right? So this week, the APA, the American Psychological Association, received and made a statement. And the statement is, consuming violent and traumatic news negatively affects your mental health. So we know that, right? I mean, we all kind of know that. But they're making a statement about it this week. They released the statement this week very specifically because of what's going on in Israel and Gaza right now. And we all also know that according to research, extended exposure of fear, anxiety, and traumatic stress can have negative long-term effects on your health and well-being. So I decided that today this was what I was going to talk about because it's been on my mind. I've been very mindful of it for myself, for my family, and as I'm on social media, seeing what's being posted on people's stories in their feed, and also reading the news, watching the news. So I thought it would be an opportunity to really just talk about how to prioritize your mental health during times like this. And I've also had in this week several clients say to me in our session, I just don't know like how to be right now with myself and with others during this time. And I also don't fully understand how this happened. I don't understand the history. And I think that people are struggling in a variety of ways. People who are not in it, really, really in it, right? So people who live in Israel, people who are from Israel, people who have loved ones in Israel. Like if you're not in it, you're struggling in a different kind of way. So I want to just talk a little bit about crises, what happens, how they impact you, talk about some guidelines for really protecting your mental health, prioritizing it, and then just talk a little bit in general about the impact and why and how it impacts some people differently than other people. So when we think about crises, we can think about very personal ones, a death, a loss, a big transition. We can think about global ones, pandemic, 9/11, current war in Israel, probably the war in Ukraine, thinking about recent. And then I live in Florida, so when we have a big hurricane coming, that's another crisis for our city and our state. Now, what happens when people are in crisis in that way, that it's very easy to become super preoccupied with what's going on. On the one hand, you want to stay up to date. On the other hand, you also can't pull yourself away from having in the moment updates on everything that's happening. And I understand that, whether it's prepping for a hurricane or it's, following the sequence of events that's happening in Israel, keeping track of the death count, whatever it is, wanting to be kept abreast of the situation so that you could speak about it intelligently. But one of the things that's really important is that you balance, and that's subjective, you balance how much you expose yourself to this with how much you take care of your mental health. And because everyone has a different tolerance, that's going to be different for everyone. My husband and I'll sort of address this a little bit. We have a different tolerance and capacity for this and willingness to take it in. So my first paid job as a therapist out of graduate school in 1999 was working in a trauma clinic. And the way that you were able to get services through this clinic, this was in New York City, the way you were able to get services through this clinic was that you had to be a victim of some crime, some trauma, and have a diagnosis of post-traumatic stress disorder. So I show up on my first day, 24 years old, fresh out of grad school, eager to learn, excited. I show up on my first day and I get my caseload of 40 clients, all of which were traumatized. Now, there is a thing called vicarious trauma. We learn about it a lot in our therapist training. But it doesn't just apply to therapists. It applies to you. It applies to you when you're watching the news and you're reading about what's happening and you're taking in all of this. That you get traumatized vicariously by witnessing, observing, listening. And so I learned very early on in my work that I had to come up with some coping mechanisms to be able to A, be present for my clients who had trauma, and B, be able to manage my state of mind and my mental health. So the challenge here that I find with people today is, how do I, on the one hand, stay abreast and up to date on what's going on, while on the other hand, I'm simultaneously protecting my mind and my mental health? And I do think that is tricky, and I think it's a slippery slope. So here are some guidelines that I offer you, and you take what works for you and you leave the rest. So one of the things that I find really helpful is that you set boundaries around your consumption, how you're consuming, from where you're consuming, and how much you're consuming. Okay. So you could check the news twice a day, morning and night. Wake up in the morning, see what's going on, see what happened since last night, and then check it again in the evening around dinner time so that you can see what happened in the day. Now, this is for the person who really wants to know. I'm not suggesting this across the board for everyone. This is for the person who finds themselves consumed with the news. And set a timer. 5-minute timer, 10-minute timer, but I say set a timer so that you're not going down the rabbit hole of linking from one article to the next article to the next article, trying to see what else might you be missing. And then you start receiving conflicting information, and then you don't really know what to believe. Which brings me to my next guideline, which is find a trusted source, one or two, just one or two. Follow those, get your information there, make sure it's been vetted, because the reality is there is a lot of misinformation. I see people posting about it. I hear people talking about it. And so find a trusted source. And thirdly, third, and I have another one, manage your conversations about it. So my husband and I chat about it. He'll talk about it a lot if I was up for it, but I'm not, actually. My husband is extremely interested in current events. He's extremely interested in humanity, in Israel, in politics. And so he likes to really stay up to date on everything. And he likes to have those conversations. I, on the other hand, am managing my exposure. So he knows that, he will sort of update me on things, new things. But if I really want to have a conversation, then I will sort of start the conversation and we'll talk about it. But what I'm paying attention to while we're having a conversation is my energy. And when he starts getting really, really worked up about something, I feel myself rising. So this is the notion of co-regulation, right? You're feeding off of somebody else's energy. And then I'll say, okay, can we sort of can we bring this down a notch or two? Now, he's not doing it on purpose. He's very emotive about it. But I know what my tolerance is and what my capacity is to really take that in, and for how large of a dose I'm going to be taking it in. So I really want you to limit your conversation around it and check your energy. And limit your conversation doesn't mean don't have it, but it means don't have that be the only thing you're talking about. So he and I talk about tons of other things. That's just one piece of it. And then lastly, I strongly encourage you to manage your exposure to images, because images carry a different level of potency than thoughts, than ideas, than reading, than hearing. When you see an image, you can't unsee it. It's seared in your psyche. You can't unsee it. Now, there are times where you hear someone talking or you're reading something and you create your own image. Yes. So, you can't avoid that. If our mind thinks in images, you'll create your own image, but it's not nearly as potent as seeing the image. And I'm very intentional about the images that I take in. And when I'm looking at the news and there's a black cover and it says the following image contains XYZ, I make an intentional decision about whether or not I'm going to look at that. And so I want you to be thoughtful and mindful about that for your own mental health. And use compartmentalization as a healthy protective mechanism. It's a healthy skill, compartmentalization. So and when I say set a timer morning and night, create limits and boundaries around what you consume, set time limits around your conversations. That's all healthy compartmentalization. It's like you're saying, okay, I'm going to take this out now. I'm going to deal with it now, and then I'm going to put it away. Because you don't want this to pervade every ounce of your being right now. That just furthers more of the traumatizing experience you could potentially have. The other thing I just want to add is that trauma is in the eye of the beholder. So what's traumatic to one might not be traumatic to another. And just because something is traumatic to me, it doesn't mean it's traumatic to you. So that's a very personal, subjective experience. So keep that in mind. And the last thing I want to say is there's no shame in protecting yourself. I think people are feeling a lot of pressure right now to stay abreast, to talk about it, to post about it, to share about it. And I think that you have to do what works for you. There's no shame in not talking about it. There's no shame in creating boundaries around it. And there's no shame in limiting your exposure to it. You really have to do what works for you. And I really do encourage people to do that, because I think that there's a lot of pressure, external pressure, and also perhaps self-imposed pressure to keep yourself abreast of what's going on. I get it. I understand. But be sure that you're balancing that out with protecting your own psyche and your own mental health. Now, if you have any questions about this or any comments, feel free to put them in the comments below. You can send me a private DM on LinkedIn or Instagram, but I would love to hear from you. So take care of yourself, take care of your mind, know yourself, know your limits, and honor them. Like, really just honor them.